My name is Mike Pfeiffer. I'm a veterinarian that works with Meow, and we have Winston here. Winston came to us last week with really not much of a history other than he'd been an outdoor kitty and had the possibility that maybe he'd been in a house fire and had sustained some burns around the outside of his ears. After our exam, we determined that house fire was probably not going to be a problem because there was no singeing of the fur around his face. And it became more likely that he may in fact have cancer on the tips of his ears. White cats are prone to having squamous cell carcinoma. That's a form of skin cancer that can develop on the outsides of the ear tips and nose from solar exposure. And we did a biopsy. The biopsy was done last week, confirmed our diagnosis that in fact Winston does have squamous cell carcinoma, and he's here today for surgery. And what we're going to try to do is ultimately save his life by removing this cancer. So our surgery today is going to be involving amputating the tips of his ear margins. And the left ear is a little bit worse than the right. We have quite extensive lesions that extend all the way back here. So our goal is to remove all the cancer with our surgery. And he should heal up well, and he should have a good long life.
People are often surprised to learn that Meow has had a canine division since we began. We accept all breeds, but serve as primary breed rescue for Chinese Shar-Pei, hairless breeds including Chinese Crested and Mexican Xolo, as well as Great Danes. Nathan was born to a Great Dane breeder who gave the puppy up because he wasn't perfect. They believed his mother may have sat on him shortly after he was born, injuring his neck. He was saved from being euthanized when a last-minute call was made to Meow's canine division. At 6 weeks old and 17 pounds, Nathan is all floppy puppy, but his head flops to the left a bit more than it should. When excited, he circles to the left, unable to get his bearings. Holding his head in a straight position and moving forward in a straight line is nearly impossible. In every other way, Nathan is normal, a big playful pup with a great appetite. Soon after his arrival, Nathan was seen by neurologist Dr. Sean Sanders at SVS in Kirkland, who diagnosed him with cerebellar disease, which may be related to injury, birth defect, or some form of disease process. Only time will tell whether Nathan's symptoms will improve or worsen.
My name is Jennifer Kissinger, and I work at Animal Emergency Service. I'm an associate veterinarian, and I do overnight animal emergency service. So the history of Mercedes is she presented to us very debilitated. She presented to us by Meow. She had just come to them that day. The history was that she had had a litter of kittens about 3 days before, and then had a stillborn birth about a day after that, and then just really seemed to go downhill. She was very lethargic, she wasn't eating, and when she presented to us, her temperature was low, she was very weak, very sick. On initial diagnostic testing, we determined that she was severely anemic. Her white blood cell count was bottomed out, so she really had no immune system to speak of. And on the x-rays, not only did it confirm that she had a severe uterine infection, to the point where the bacteria was actually producing gas in her uterus, which is really serious. But then there was sort of a large heart or a mass effect by her heart, which was totally unexpected. And so when I talked to Bonnie of Meow, we decided that we were going to do an ultrasound. The ultrasound then showed that not only did she have a very severely infected uterus that had ruptured and was actually causing loose fluid in her abdomen, but this mass effect in her heart was actually her liver that had come through a hole in her diaphragm up into her chest. So this was very unexpected, very severe, and all of these things combined, her severe anemia, her wiped out immune system, the severe ruptured infected uterus, and this diaphragmatic hernia, hole in her diaphragm, each of those individually could have been a fatal situation for her, and combined, obviously, really didn't look good for her. And so I talked to Bonnie of Meow, and we sort of discussed the situation. I did give her a very poor prognosis. I thought there was maybe a less than 10% chance that she'd survive.
So this is a little close-up of the squamous cell carcinoma along the ear margin here. And we're going to resect all of this. We're going to try to resect enough that we're taking all the cancer tissue out and leaving nothing but healthy tissue behind so that it won't have any issues with regrowth. And if this kitty can stay out of the sun, there's a very good prognosis for this not to reoccur. This type of procedure is costly, but ultimately it's going to save Winston's life, because without it, this cancer is going to progress and ultimately it's going to be inoperable. The squamous cell is a serious form of skin cancer, but it's slow to metastasize. So if we catch these early enough, we have a very good chance of arresting it at that point and not having to deal with it again. The ability of Meow to help these kitties, and it's really the Mercy Fund that has made that possible, and this is an example of a pet that we can make a difference on. We can save this kitty's life. He's going to have a full, happy life with some lucky family, and it's all because of that Mercy Fund. Thank you.
Over the next 4 to 6 months, Nathan will require lots of physical therapy to encourage his brain to develop the neural pathways necessary for him to understand where he is in space and to help him to hold his head up as he grows into the very large dog he will become. He may require expensive diagnostics, including an MRI and CAT scan. No matter what the future holds for Nathan, we're there for him. In the rescue community, feline and canine alike, Meow is known for our unfailing commitment to all animals, but especially those who have special needs and challenges. Since Meow began, we have never made a decision about an animal's medical treatment based on cost. Your donations to our Mercy Fund ensure that this extraordinary medical care will always be there for animals like Nathan.
And I'll never forget what Bonnie said. She said, well, we have to try. And that's what I love about Meow. So we did. We tried. And we were able to pull her through it thanks to Meow. And I just have to say that, you know, not only is she alive today because of Meow, but that's what I really love about Meow, is that they are really dedicated to the care of the animals that they take in. And so not only is she alive because of Meow, but Meow is in a unique position to be that dedicated to her care, where many, in fact I would dare to say most, wouldn't have stuck by her given such a poor prognosis. And we were able to do it and pull her through. And Meow is an amazing organization because of that.
My name's Dr. Marco Hanlon. I'm the owner of Animal Emergency Service East in Kirkland, Washington. Without Meow and without the Mercy Fund, Mercy wouldn't be with us today, and all of the future Merceys that come in would not be able to receive treatment. At this time, if you can make a donation to help these kitties out, we'll make sure it goes to good use.